Good evening, ladies and gentlemen. A very warm welcome to you to today's special discussion, Sanofi Diabetes Dialogues, a series where we will broach various topics related to diabetes, the disease, the myths, various facts and fiction, and all things in between. In today's special, we will be debunking the myths that surround diabetes, its treatment options, and various other facets. This is a series and it is an initiative powered by Sanofi India. So let's start with some brutal facts. Diabetes is one of the fastest growing global health emergencies of the 21st century. Most of us know it as a condition where the pancreas does not produce enough insulin or where the body is unable to use the insulin it creates effectively. Insulin is the hormone that regulates our blood sugar levels, and high levels of insulin start to silently cause damage to our body. Those living with diabetes have a 2 to 3-fold increased risk of developing cardiovascular diseases such as coronary artery disease, stroke, and heart failure. In fact, in the long run, if not treated, it can even damage the kidneys, nerves, and other vital organs. It could possibly even result in loss of vision. Scary, isn't it? Well, let's all be better informed about diabetes, and who better to chat with than renowned experts in this field. I'm your host, Anisha Nair Dhawan, and joining me for today's discussion are two specialists. Please welcome Dr. Dheeraj Kapoor, DM Endocrinology, who is the Chief of Endocrinology at Artemis Hospital Gurgaon, and Dr. Jasjeet Singh Wasir, MD, Internal Medicine, Director, Endocrinology and Diabetology at Medanta Medicity, Gurgaon. Thank you, gentlemen, for joining us this evening. I can't remember the last time I met a friend who did not know someone or has someone in their home living with diabetes. In fact, Sanofi's landmark study has shown that only 1 in 5 people living with diabetes in India achieve glucose level control. That is an estimated 74 million people diagnosed with diabetes, accounting for 1 in 7 of all adults living with diabetes worldwide. And the idea says that almost 1 in 2 adults with diabetes is perfectly unaware that they have the condition. So let me start with you, Dr. Kapoor. Can you help me open this discussion with answering this question that why are the numbers so staggering? Is it because diabetes has no immediate or visible symptoms?
Diabetes literally means to pass through, which means excessive urination. That was it. And that led us to believe that unless there's increased urination or then the increased thirst, weight loss, we don't have diabetes. But unfortunately, 60% of people don't have symptoms of diabetes. That is the worst part. So people come to us with obnoxiously high sugars and still asymptomatic. They were tested purely because if they were undergoing any surgery or as a routine packages, they call it these days. That was the reason they were diagnosed. Now, the staggering number, I guess, numbers were huge. They weren't diagnosed. But now, the problem is the diet and the exercise. The diet has remained same over the decades or possibly worsened to a major extent, but exercise certainly has gone down. You see, we say we work hard. Honestly, me and Jasjeet are not working hard from 9 to 5. The metabolic hard work we are not doing. We are doing mental hard work. And then this concept of work hard and party hard. So, working hard is not on, but partying hard is on. So, that is why these huge phenomenal numbers. To this, add the mental stress. So, you control your diet, you control your exercise, but you are stressed, you're not sleeping well. Believe you me, you will have sugars out of hand. Travel. Most of us, try to save the day by early morning travel, and we aren't able to save our metabolism. So, on that account as well, we end up being penny wise and pound foolish. So, just to summarize, 60% of people don't have symptoms. The non healing wound, the ulcer, Tuberculosis, we don't count as symptoms of diabetes. I mean, most physicians. The diet has gone for a toss, exercise has gone for a six, stress has increased. So these are the various factors where the numbers are staggering. And the myth is that all people will have weight loss, will have thirst, will have increased hunger. That needs to be, debunked.
Right. So you're saying that the big problem occurs because people are unaware of their condition. But Dr. Vasir, so many people say that we hear so many of these claims that I got cured of diabetes, my diabetes was reversed. Can you throw some light on this? And can you talk to us about the treatment options?
That's actually a $1 million question. And you type diabetes reversal on any search engine, get a million articles on that. But you search the same on the scientific text sites, and you find that the word reversal has disappeared from that. And what appears, the scientifically correct word is remission of diabetes. Without going into the media controversy of what is the right word, the scientific communities have endorsed remission to be the right word. Now, what's the difference in remission and reversal or cure? Reversal and cure means you're going in the straight direction, you suddenly take a U-turn and start going in the opposite direction. To a patient who's hearing the media and reading the media, what does it mean? Their blood glucose levels are normal, they're off the medications, and they're allowed a self permissive lifestyle. So you can eat, drink anything, and the sugars will not come back, and you are not on medications. That would be the general perception of understanding of the word reversal or cure. However, the correct thing is remission, that with the correct guidance which requires a team effort, you will come off medications, your blood glucose levels would be normal, but the third part of a self permissive lifestyle does not exist. You have to walk the straight line to maintain the blood glucose levels at bay. And once you break that lifestyle, most of the times, I would say 8 to 9 out of 10, the blood glucose levels will come back. So it's like, think about a building in which you're sitting in, a room in which you're sitting in. The structural integrity of that is based on the pillars, the concrete pillars. Fine. So, like that, the integrity of the room in which we are sitting in, the same way we have pillars for diabetes care, starting from nutrition to fitness to medications, including tablets, insulin, which we will be talking about more, self care, including self monitoring of blood glucose levels, regular physician visits, regular screening of complications. Just these five things all put together can ensure a long, healthy life without complications of diabetes. Plus, happiness index goes high.
All right. So it's best to say there is remission of diabetes without saying it has been reversed. But Dr. Kapoor, let's talk about the treatment options. One of them, of course, is being prescribed insulin, and most of the times, most people associate insulin with injections. Do all patients suffering from diabetes require insulin?
Okay, so diabetes is broadly of two types. That is type 1 diabetes, which is insulin dependent. So these people require insulin not only for sugar control but for survival. The other is type 2 diabetes, which we see the garden variety, which we see day in and day out. Now they can be managed on tablets as well as insulin. So, first of all diabetic patients do not require insulin. Now, insulin being an injection is not a myth. No, it is a reality. In fact, it is the only injection which is available. Insulin tablets are not available. The other issue is that the insulin phobia, that now I'm on insulin, I'll be on insulin forever. That from the patient's perspective is true to a major extent. And why do I say that? I know I must be ruffling a few feathers amongst the doctor fraternity, But the fact of the matter is that most patients do not opt for insulin till the time tablets have stopped acting. So, how does one expect to go back from there? That is one. But the real story is that insulin stoppage is absolutely possible. It is not an addicting medicine. You can easily stop it. All patients who undergo surgery will be given insulin in hospital. Most pregnant patients with diabetes will be given insulin. Most diabetic patients, in fact, all diabetic patients who conceive, I mean, diabetes before and then conception, they will be given insulin. And in most of these instances, insulin will be stopped. So, insulin once started cannot be stopped? No, that's a total myth. The other issue is that insulin phobia needs to go. Tell me something. Pregnancy. Here, mind you, you are dealing with two lives, the child, the unborn child, and the mother. If something is safe for the yet unborn child, how can it be unsafe? On a more emotional note, something has been there since 1921, still going strong. So many tablets have come and passed on. This stays as strong as ever. How would an medicine which is unsafe would last this long? So, to summarize, insulin can be stopped. It's not an addicting medicine. It is safe, and injections are virtually painless, particularly in the context of people checking their sugar 3 or 4 times a day. The sugar checking is painful. Injection is not.
Right. Talking about gestational diabetes, actually, I had gestational diabetes during my pregnancy, and I'm living proof that I took the insulin pen, I took the injection, and I no longer do it. So it's not something that you have to live with for the rest of your life. Dr. Wasir, insulin treatment has so many myths, and you are trying to debunk some of these. And these are pretty deep rooted. Can one lead a normal life after starting insulin? You spoke about self moderated lifestyle. Does this go hand in hand with using insulin?
Yeah. So let's first start with understanding, as Dheeraj rightly talked about the places where insulin is needed, where it needs to be started. Briefly talked about the safety aspects of insulin. Now, one very important thing about the inertia when it is actually required of starting insulin is bidirectional. It comes both from the physician as well as from the patient. And from the patient's perspective, there are three or four main myths surrounding the inertia towards reluctance of accepting insulin. So let's bust those myths. First myth is it's painful. Answer is it is painless, and it's a very easy way of doing it in the OPD. When I show the patients, I have a live demo pen in my outpatient. When you open it up, show them from a distance, they are not able to perceive the needle. So something which you can't see, how can it pain you? First. Second thing, Dheeraj also talked about the safety. Well, just taking a clue from what he said, pregnancy is one state in which whatever you do, the first most important tag is it should be safe. And insulin is the drug of choice for control of blood glucose levels during pregnancy. So, myth number two busted. It is the safest thing because it is safe for use and there is no adverse effects on the mother and the developing fetus. Third myth, again very deep rooted, and that is the most important of them, why reluctance to insulin comes, is the fact that insulin shuru kiya or complication ho gayi. And it is so full of fear in the patients. What happened is, going a little deeper into why it has happened, because of the clinical inertia coming from the physician and or the patient, insulin was delayed. Then once organ damage starts, then the longevity is compromised. A situation may come where nothing else can be given and insulin is given with a already compromised longevity. So the main culprit here is possibly delay in starting the insulin, not the insulin in itself. So I hope that that takes care of the question you asked about busting the important myths around insulin and diabetes.
That's true, Dr. Vasir. I want to ask Dr. Kapoor, this whole fear about needles, about insulin being painful, I think really painful. I mean, this is something, patients should know, because Dr. Vasir said he's showing the insulin needle to his patient. They can't even see it in his OPD. So why this fear?
First of all, it is injectable, so pain is bound to happen. That's what the people believe. Why do you feel pain? The moment you have an injury or a trauma or maybe a prick, the nerve endings they carry the sensations. So, for example, intravenous injections are not painful, intramuscular are painful. Right? On a similar note, once you check the sugars, the fingertips have a very high nerve ending concentration, and therefore sugar checking is painful. The sites where you inject insulin, first of all, it is not intramuscular, it is beneath the skin, subcutaneous. At that point in time, there are not many endings, and it is a very sharp needle. In the good old days, it used to be a long needle, a broader gauge needle, so it could well have been painful. But now, with the advent of pen, you see, as he pointed out, you can't even see the thing. How will it pain? So we have such narrow needles, short needles, that they will not cause pain because less nerve endings and narrow needles. However, I would now wish to tell the situations where insulin injection can cause pain. Some people have this habit or are not made aware by the care provider that you are not supposed to wipe the insulin needle. The moment you wipe it off, the silicone coating goes off and that injection might become painful. So, it is not insulin, it's your own doing. The second is that have you ever tried hammering a nail? Something that is pointed goes in so well and so smoothly, right? A blunt nail would not. So if the needle goes blunt after repeated uses, it can then pain. So these are two situations where insulin injection does pain, but then these are absolutely avoidable. I'm not saying that you change the needle every time. Ideally, you should, but I think 3 to 4 times is the time you can, but certainly not more than four because by that time it would have gotten blunt and will cause pain. So, to suffice, insulin injection virtually painless. Do not wipe it with a swab, the needle part I'm saying, and also do not use it more than 3 times, at most four, certainly not.
All right, Dr. Pur, thank you so much. Those are very helpful tips for those using the insulin pen. Dr. Vasir, we also commonly hear from friends and family that insulin is addictive. Once you take it forever. And it also makes you gain weight. Is this true?
So I'll alter that question's word of addictive. Insulin is not addictive, it is protective. And the protection of insulin comes through the fact it is the safest when used correctly with education, the most effective treatment for lowering blood glucose levels effectively, safe and effective. Now, right at the beginning, when you were introducing the topic, your description of diabetes had a mention of insulin 5 times. And the physiology of the normal human body is one of the main ways in people who are not diabetics. How is the blood glucose levels controlled? Well, it's one of the most important factors, not the only factor, is through the endogenous or what insulin the body produces. So something what the body produces in itself, how can it harm the human body? So this is like me having a discussion with a patient in the OPD, and it really helps them understand that this is a part of you. It's a part of the physiology. We're just adding that. And as you said, some patients produce less insulin, some patients, the insulin is ineffective. You're just completing the equation, which would lead to better sugar control. The latter part of your question talked about the weight gain. Yes, there is a dose dependent increase in the weight with insulin. So higher dose, if you're on 200 units, we expect a greater increase. And if somebody is on 10 units, there would be a much lesser increase. Very importantly, the newer or the second and the third generation insulins are pretty weight neutral, or they have a less chance of increasing the weight as compared to the earlier insulins.
All right. Dr. Kapoor, another common refrain that is used very commonly against, taking insulin is that it causes hypoglycemia. Can you explain to us what is hypoglycemia, and is there any merit to this argument?
Yes, insulin causes hypoglycemia. There's none denying the fact. Hypoglycemia is not a side effect, it's an extension of the effect. Insulin is meant to lower the sugars. So, this being a general program, I'll be a little less scientific, and that may be hilarious to a few, but that is the way I'll wish to explain about the hypoglycemia business. So, once you go out shopping, you fall short of money. When does that happen? Number one, you haven't taken enough money, right? But shopping तो उतनी कर ली आपने. The other issue is that you have taken the money but shopped more, which means you had the food but more of exercise. And last but not the least, you took the money but your pocket was picked, which means either you vomited whatever you ate or you had diarrhea. So these are the three things wherein the insulin, which was normal on a usual routine day, has now become the culprit. So one must be very careful. So it is an extension. Now, the medicines which were used in the past, what we call the sulfonylureas, even they are notorious for causing hypoglycemia. And mind you, hypoglycemia caused by sulfonylureas, it's much, much more dangerous and longer lasting than insulin. The shorter acting insulins, if they cause hypoglycemia, go to the emergency, have yourself, and you're unconscious, have yourself infused with dextrose, and maybe 4 or 5 hours, at most 6 hours, you're good to go home. Sulfonylureas, they cause hypoglycemia, go to the emergency in unconsciousness, they give you glucose, sugars rise, but the tablet is still in the system and the hypoglycemia goes on happening, and we call it a recurring hypoglycemia. No, it is not a recurring hypoglycemia. It is the same drug which is causing all the fiasco. So, yes, any medicine which will lower the sugars has the potential to cause hypoglycemia, insulin being no exception. But hypoglycemia caused by insulin is much less dangerous and much shorter lasting as compared to a tablet. I think these are lame excuses which are being forced across by the patient who wants to stop insulin on one pretext or the other. And mind you, with tablets on, also you need to check the sugars. With the newer ones which cause lesser hypos, possibly not as aggressive sugar monitoring as with insulin, maybe once a day, twice a day, sometimes 4 times a day. Not as aggressive, but certainly blood sugar monitoring, which is painful, you can't get away with that. Um, but yes, insulin hypoglycemia much less dangerous than that by sulfonylurea.
All right. So hypoglycemia can be managed even when you are using insulin. Those are the steps that Dr. Kapoor has informed everybody about. If you do suffer from hypoglycemia, what you need to do. Dr. Wasir, what happens if you fall sick? Do you stop taking insulin? Do you feel better? Because if in sickness your blood sugars are going down, what should you do?
So, sickness is more like a umbrella term for any medical event happening. In that, The blood glucose levels can go either way. They can either go high or go low. As Dheeraj mentioned, loose motions and hypoglycemia, a very, very characteristic thing which happens. You get any infection, the sugars go up. So the blanket statement, if you get ill, there should be frequent monitoring of blood glucose levels. The red flags is when you're not able to eat well, your oral intake is less, you're having recurrent vomitings, your urine output decreases, you're having very hectic fever. There are some levels of altered sensorium is a red flag. You immediately need to report to the hospital or connect with your doctor. They will decide about what needs to be done. If you're doing fine, if you're eating well, your oral intake is fine, you have to check your sugars multiple times. And as a mandatory part of education about insulin in diabetes, we tell our patients about managing sick days, check your sugars, and we empower them to alter the doses as per the blood glucose levels. But anything you feel you get stuck in, you must go to the emergency. Don't keep things in your hand and stop insulin or take insulin when the sugars are varying that much. So as a part of any and every diabetes education, sick day management is mandatory, and so also for those who've been prescribed insulin, how to manage sick days. I just gave a very generic kind of view in understanding when or what to do if you get sicker.
All right. You both of you have busted so many of the myths surrounding insulin and diabetes. Thank you so much for sharing your insights. In conclusion, Dr. Kapoor, would you like to say something to those watching this show who may be having diabetes?
Yes, so that if you have diabetes, God forbid, there are basically five medicines that you need to start from day one. Number one is diet control. That's a medicine for you. Number two is exercise. Number three is taking care of your feet, because foot injury and foot ulcer are very, very notorious in diabetes. Number four is SMBG, self monitoring blood glucose. Number five is hypoglycemia management. These are medicines for you. Medicine doesn't mean a pill. And secondly, insulin is one of the safest medicines for diabetes, painless, and only beneficial.
Right. Dr. Vasir, what would you like to say in conclusion to everybody watching this show?
So, since Dheeraj showed five fingers, I won't repeat those five fingers. Going beyond those fingers, we have five more. I'll just talk about two, three more things extra. Is annual screening of complications. One of the organs which is forgot, the two main organs which are actually not looked at that often, which is mandatory to be screened, are the eyes and the feet. Both the ends of the body need to be looked at with regular screening. Another test commonly missed is a urine testing for albumin excretion. You can catch the kidney involvement with diabetes really early, and we have very powerful tools to stop kidney damage and possibly reverse that. Now, this is a place where reversal becomes the right usage. And then regular visits to your physician. Very surprisingly, though we say diabetes care is chronic care, but in practice, and Dheeraj would also agree with me, that more or less problems happen and a patient would go to a doctor. So that becomes acute care. So if you've been recommended a 3-month follow up, with everything being fine, that is the right time to go to your doctor so that for next 6 months you stay fine and maintain all of that. So everything which Dr. Dheeraj said, compiled with complications monitoring, regular physician's visit, would be the best diabetes care available in this time anywhere in the world you go.
Thank you so much, Dr. Kapoor and Dr. Vasir, for joining us. I really feel better informed about diabetes after this session. Thank you for sharing your insights with us. It was indeed a very informative session. So, if you feel that you have any symptoms of diabetes, consult your doctor immediately and don't shy away from taking insulin if you need it. This is your host signing off from the Sanofi Diabetes Dialogue. Stay well and take care.